We are today talking about chronic bronchitis. What it is, chronic cough more than 2 to 3 months out of a 2-year period. It's an inflammatory response, usually to some sort of irritant. You may not even know that you have chronic bronchitis. You just assume that you've been coughing for a long period of time. That's when you need to come see us so we can evaluate you. Oftentimes it's caused by cigarette smoking, maybe an environmental issue where you're working, dust, coal dust, environmental hazards, cleaning supplies. Could be issues with mold in your house and a chronic exposure to an irritant. The mucus is a immune system response really that inflames your airways and secretes thick secretions into the lumen of your airways. You can see right here on one example, this is a normal looking airway right here, nice and clean and open. And as your inflammation builds up, you start to have some thickening and secretions. This is what you start to cough up. It gets worse and you have more swelling, and then this mucus globs are harder and harder for you to cough up to the point where it gets now completely occluded. And these are the stages of chronic bronchitis. Once we identify that you have it, what the etiologies are, we offer treatments. First, we test you with a chest x-ray, which we do here in all our offices. Then we'll do some breathing tests. We call them PFTs, pulmonary function tests. See how severe your lung function is or how much of a decrease in the ability of you to breathe is. Then we start to attack it on many levels. One is reduce the inflammation. We may give you steroids. Other is to dilate and open up these airways so they look normal again. We use inhalers. Some inhalers are dilators that we call bronchodilators. Maybe you take them every now and then, or maybe you need to take them every day. Hopefully you improve to the point where we can reduce those therapies back. And when we're talking about chronic bronchitis, I want to emphasize something. We go through a lot of patient literature and handouts that we will review with you. One of them that we really like to use is this handout, coughing over and over and over again. Of course, that can be signs of chronic bronchitis, but we also want to review to make sure you don't have any type of other chronic conditions in the lungs, like a chronic infection. Sometimes we worry about something called non-TB or non-tuberculosis infections. The most common one we worry about when we're working up a patient with chronic bronchitis and chronic cough is something called MAC, Mycobacterium avium infection. We have excellent treatments for it. We go through a process of identifying and diagnosing it and helping you breathe better again. That's our job.